Thanks very much. And thanks everybody for being here today. I know if you're anything like me, you might be coming off of 3 to 4 days of additional conference attendance. So well done you for sticking with it to Friday. The first thing to tell you is that I've actually changed the title of my talk, which you'll see shortly. The second thing is I would like to acknowledge the traditional owners of the land where we're meeting and pay my respects to elders past, present, and emerging, and any Aboriginal or Torres Strait Islander people here today. So my talk, it's no longer called vaccine hesitancy. I'll get to the more detailed title, but essentially it's now understanding and addressing vaccination uptake in Australia. And I'll explain a little bit more why I've taken hesitancy out of the title, but I encourage all of you to think about that and think about how when you think about what's happening with vaccination rates, there might be more going on than just hesitancy. And so hopefully at the end of this presentation, you will be able to understand, get a better picture of what's going on with vaccination in Australia and some of the factors that are influencing those vaccination rates. And also identify some of the potential strategies that we might be able to use to address all of the very diverse behavioural and social drivers that are affecting those vaccination rates in Australia. I spent a lot of time drawing these little stick figures. They will appear multiple times in the presentation. I hope that you are very impressed with my artistic skills. So what is happening? Well, first of all, we know, I'm sure, that childhood vaccination coverage has been declining for the last few years. We're not talking about huge numbers. You know, this isn't like all systems code red. However, it's consistent. We've seen declines in all the age groups since 2020. We've seen some concerningly slightly larger drops among some of our First Nations children. And the big issue here is that we're below the 95% target, really for almost all children. And we know that what this doesn't show us is the pockets in our communities that are much lower. HPV vaccination is the good news story. It might be the only good news story that I'm talking about. So well done to our adolescent and school-based immunizers. You are being somewhat helped by the fact that we're back in school and we only have one dose, but that doesn't take away anything from your excellent skills. And in fact, I really do want to highlight and commend the program, the school-based program in Australia. It's incredibly effective. I'm doing a lot of work in some other countries that are introducing HPV vaccines right now. And all I can say is, you know, Australia, as we know, is head and shoulders above the rest of the world and should be really happy about that. Influenza vaccination's not doing so great, though. Look, we've seen some significant declines. Obviously, the caveat is it's pretty early in this flu season. I do want to just highlight really that, you know, children under 5, that really big drop. I know it was almost artificially high during COVID, but it's very low now. We also, I think, need to be really concerned about the significant drops in our most vulnerable older adults, particularly First Nations adults. Yeah, not the best news story. So why? What do we know about what's going on here? I know we have lots of ideas, and I think, you know, certainly the media, including an article today in The Guardian, wanted to say, oh, it's COVID. Everyone's tired of COVID. They don't want to get vaccines anymore. It's just poisoned everything for vaccination. And I'm not going to say that that's not a factor, but what I'm going to show you is evidence around what we know the factors are so far. And I have to say it's not a factor that's coming up in all cases or with all people. So there's lots of other things going on. And this is really where I want to say it's more than hesitancy alone. Hesitancy is sort of a get out of jail free card, sometimes for governments to say, because then they get to say it's all their fault. They're hesitant. They have questions and they don't trust vaccines and what's wrong with them. Really, one of the big things that we've learned is that the practical factors, the accessibility of vaccination is just not there. It's not as good as we think it is. It's not enough just to have a free program. So I'm going to unpack that a little bit more, but I just really think every time you hear somebody say, oh, it's vaccine hesitancy, say, and all the rest. So Some of the data that I'm going to show you today is super fresh, hot off the presses from this project. This is a Commonwealth-funded collaborative project. You may have seen Professor Margie Danchin present some of this data at CDIC this week. This is a project where we're applying validated instruments, so the Vaccine Barriers Assessment Tool, which is an NHMRC-funded project to develop and validate a tool to assess barriers to childhood vaccination, and the WHO Behavioral and Social Drivers tools, which Julie's group has been working on globally. We use these tools in nationally representative surveys to really unpack what's going on with routine childhood vaccine uptake, childhood influenza vaccine uptake, and adult flu uptake. So some of the data, when you see it sprinkled through, it's coming from these surveys that were done March, April this year with over 2,000 participants in each survey. So some of the factors that we know are affecting routine childhood vaccination. You don't have to be able to read this whole slide. This comes from that that Vaccination Insights project that I mentioned. This is among the whole sample, what were the most frequently reported barriers? Interestingly, parents are saying they feel distressed about vaccinating. So those of you who have dealt with parents who have needle phobias, some of that's genuinely an issue in our population. And then can't afford the cost, not easy to get an appointment, don't prioritize the appointment. That doesn't sound like vaccine hesitancy to me. We also did some deeper analysis where we looked at which barriers were actually associated with partial vaccination, which is the group that we're most interested in. So those people that started the schedule, but their kids are delayed or haven't finished it. And we wanted to know why. And again, I'm not going to present all the data from it, but concerns about safety and effectiveness definitely associated with partial vaccination, but cost and appointment availability also significantly associated with partial vaccination. We also do know that misinformation and misperceptions are on the rise. This is a study that we just published from data that we collected in 2017 and then repeated in 2023 with the Royal Children's Hospital Child Health Poll. And I was honestly kind of shocked at the increase in number of people who think vaccines cause autism. I really thought we were getting on top of this. It's been 25 years since Wakefield's study. And, 6% more parents now think that vaccines cause autism. 8% more parents think that kids get too many vaccines in the first 2 years of life. So certainly there is also vaccine hesitancy going on. So let's look at child influenza vaccine uptake. So this is that pediatric flu program. Again, same program, same data that you're looking at here, but this is about child flu uptake, that distress about vaccinating. Parents who say, I wouldn't really feel guilty if my child got flu and they weren't vaccinated. That really comes down to it's sort of a marker for not thinking the flu is a serious disease in children, and then not prioritizing the flu appointments again. We also looked at associations with people who didn't plan to vaccinate their child this year for flu. And again, safety, effectiveness, and lots of different access issues, including transportation, not being able to get to an appointment, also not being able to speak about vaccination in the same language that you would like to speak about it with your provider, all associated with not planning to vaccinate their child for flu this year. There is also a lower level of knowledge and awareness about child flu, the disease, and also the program. So this is very recent data from the Child Health Poll. A third of parents don't know that flu causes serious illness. 44% don't know the flu vaccine is recommended to kids over 6 months, to all kids. And over 50% don't know that it's recommended every year. So we are still missing out on some of that awareness raising around the flu. This is a whiz-bang presentation, by the way. It's going really fast. So if you have questions or if you want to know more about some of the data underpinning this, please reach out to me afterwards. So looking at adult influenza uptake, it's a familiar icon, isn't it? This was a really great study that the Immunization Coalition put out. Again, very recent, huge sample, 20,000 people. Only 30% of adults plan to get the flu vaccine this year, mostly to protect themselves or, and put a pin in this, healthcare worker recommended it. We know how important that is. And, people just not prioritizing it. They don't see it as important or beneficial if they're not planning to get it. Now, this survey is one of the only ones that's shown some specific data that says the COVID pandemic has reduced flu vaccine intention for a range of reasons. Too many vaccines, don't think they work that well, kind of thing. I personally think that the COVID pandemic impact is more likely to be affecting adult vaccination for themselves than adult decision making around childhood vaccines. And that comes from some of our data and also from a lot of my qualitative research where parents are saying, no, I'll still vaccinate my kid, but I don't want the flu vaccine. I don't want any more COVID vaccines. This is a busy slide. This comes from the Vaccination Insights Project, but this is using the WHO tools. And they looked at previous uptake versus, and its association with intention. And basically what this slide shows you is pretty clearly if you got 2 doses, if you had 2 flu vaccines in the last few years, you're much more likely to plan to get more. And if you had none, you're also likely to not want any more. However, we wanted to focus in on the people who have had the flu vaccine in the past and don't want it anymore. So again, a busy slide, but we wanted to know what was associated with changing your mind away from wanting the flu vaccine. So you got it and you don't want it anymore. People who didn't think it provided personal protection or protection to others were more likely to say, what's the point? If they didn't have that social responsibility and friends and family, so those social norms around the flu, then they really weren't as likely to want to get it again. And again, if they hadn't had a recommendation from a provider. But I just want to draw your attention one more time to that idea that the practical issues come in here. If you don't know where to get a flu vaccine, you are more likely to say, well, what's the point? I guess I just won't get one this year. I didn't mention maternal vaccine uptake in my little snapshot in the beginning, and that's because it's very hard to get data on the maternal vaccine uptake. I know we heard that you can get some data from Victoria, from Michelle Giles, but the most recent report from that's 2021. So I don't actually know how we're going on our maternal vaccine uptake nationally, but we've been doing a number of qualitative studies preparing for this new crowded space when the RSV vaccine potentially comes out for pregnant women. And what the women are telling us is that they want information about all the vaccines early in pregnancy. They want plenty of time to think about the decision. They didn't like being pressured to get the vaccine and to make a quick decision during COVID. They want consistent messaging from all their providers. And that's another really important point. Women are doing shared care. They want the GP and the midwife to say the same thing. And obviously they want safety data, but I thought it was interesting. Some people are saying, if you tell me about how the traditional testing process for RSV takes a long time and it has all these people in it, that's more reassuring than the fast testing process for COVID. So we can actually give them a little bit more data and a little bit more reassurance with RSV, and we should be capitalizing on that when we're talking about it, and always emphasize the protection of the baby. So what can we do about all of this? Well, the WHO has very helpfully put together some evidence around the types of interventions that might address problems or issues that you've identified in these different areas. Obviously, a lot of communication-based interventions to change people's thoughts and feelings and their motivation, social interventions to improve trust and things like that, and then all of those different approaches to address specific practical issues. So yes, we can and should be informing and educating the public, but it is definitely not enough. So we can't assume that this is a knowledge deficit issue where people just don't know. So if we tell them, they'll do it. Obviously, that doesn't work. That said, we did flag some key gaps in knowledge and awareness that could be addressed with some information. Broad campaigns, probably not that effective. Historically, they haven't been that effective when the governments put them out. They may work better for a big new population-based vaccine or something, so maybe with RSV. But let's get creative. So this is a game called Cranky Uncle that I'm working on adapting for an Arabic-speaking population, which teaches you not just what the myths are about vaccines, but what are the tricks that people use to spread misinformation? What are the sort of fallacies that people use in those arguments. And, can we get more people to play things like that and learn some of those critical thinking skills? Support provider recommendations. Kasia is going to tell you a lot more about Sky, sharing knowledge about immunization. But again, there's lots of different resources out there, and just being here is one way to upskill and really emphasize how important that recommendation is. And again, I want to flag that importance of making sure we're getting consistent messaging across all of the different types of providers, particularly for pregnant women. This is probably the number one thing that actually moves the needle. Engage communities to build trust. We learned a lot of these lessons during COVID, and then we stopped funding them. So we had all of these amazing connections with multicultural leaders, religious leaders. We found all of these communities in our society, and we were really reaching through to them. There are ways to keep working through this even without the big COVID funding. So we work on a broad program called the Vaccine Champions program, where we do a lot of work in other countries. But I honestly would love to develop a version of this program, particularly to promote maternal vaccination. So, if within your community you're seeing issues, who are the connectors in that community? Who do people listen to? And can you reach out to them and bring them into the fold and get them to help share some of your messages or share their own messages and their own stories about vaccinating to build that trust? And then in terms of the practical side, remind, prompt, make services convenient, set up the reminder recall systems wherever you can, expand your community outreach, extend your clinic hours, and really offer those specialized services for people who need extra support, like people with disabilities, or in this case, is the kid getting a virtual reality headset to help him because he was afraid of needles. So in summary, I see you there, NIP and influenza rates have dropped. Accessibility is a barrier even for funded programs. Even when you think it's free, there's always other costs that people face. However, there are also concerns about vaccine safety and effectiveness. And we really need to be measuring these barriers regularly. And that's the goal of the Vaccination Insights Project, is to repeat these surveys regularly so we get an ongoing picture of what's happening in the community. And finally, strategies to address this should support those provider recommendations and trust and accessibility in the community. Thank you very much. And if you're interested in this kind of work, consider joining COSI.
Thank you so much, Dr. Jessica. Now, any questions from the audience members? Please come up to the microphone so our online participants can hear. While you're thinking about your questions, really interesting, I just got an email from Brisbane Metro North, which is my PHN, and they were mentioning that the influenza vaccine coverage was 23% overall, certainly could do better, and only as low as 16.4% in the under 5s, which we know are the high risk group. So lots of work. Question over here.
Peter Richmond from Perth. Great talk, Jess, and I think you've given us lots of lessons that we need to think about when we're dealing with patients. I wondered what you thought about the talk we had yesterday at CDIC around social media monitoring and how that actually might be useful in this sort of context, because I do wonder whether part of the COVID issue that people don't report but actually is happening subliminally is the algorithms in social media, that if you've had a query 4 years ago about a COVID vaccine, you're getting fed all the negative things about other vaccines as well. Do you have a comment on that, or whether we should be looking at that sort of approach?
I have so many comments on that. I'll keep it short, though. It's a complicated area, and there's a lot happening in this space. So in addition to the media monitoring we heard about yesterday, there's also really exciting new sort of AI and machine learning type tools. My only concern about them, I think they're really useful to identify trends that are spreading and things like that. I have not yet seen a really compelling argument about what you do with that data, because ultimately you have to address it at the community or even individual level. And so knowing that it's happening doesn't really help us target those interventions. And so I think we still have some really important thinking to do about, what we can also do to address that. And maybe one of the things Joe Smizer said was he has this network of influencers that can put messages out online. I don't know that we have that yet in Australia, and I don't know what the impact of that yet would be.
And I was thinking more from actually assessing our current programs as whether or not they're working. Do you know what I mean? The messages that people are putting out, are they actually getting through on that sort of network scale?
Oh, that's a good question. I mean, that's a slightly different question in terms of trying to track the reach of particular things.
Yeah.
Look, I think I can say without having the data behind me that your health department message and things isn't getting nearly as far as the TikTok dance video. So I think we do have some work to do in that. But no, you're right. I think getting a little bit more data on where those messages are going and who's seeing them would be helpful.
One last question.
Hi, Doctor. I'm Angelo. I came from a very diverse community and as well from developing country. Now experiencing my practice here in Australia. I'm just trying to see like how regarding about the vaccination that's predominantly back where I came from. We have our natural vaccination, vaccine induced vaccination as well as a passive acquired vaccination. So we are for me, as I can see from your data itself, like it's really like imposing about introducing vaccination. How about we try to, reintroduce the conventional way of acquiring immunity, such as like, the passive acquired and then the maternal acquired type of vaccination? Because as you said, that hesitation is really skyrocketing from the time being because of the fear, the introduction of social media and the Dr. Google, something like that. So that is what's just on my thoughts right now.
Thank you for your comment. Look, I might not have entirely understood the point. I think passive immunity acquired through maternal vaccination, passive immunity conveyed to the baby is incredibly important and valuable. I would push back on the idea that we want to encourage passive immunity acquired by disease infection. It's a fact of life in many countries, and certainly it does mean that people end up being immunized against diseases. But I think in Australia, where we're trying to, avoid infection and avoid morbidity and mortality, it really does come down to actually encouraging people to get that real active vaccination. But I appreciate your point that maybe it's about shaping that message in different ways for different communities who may be a little bit more used to different kinds of approaches, I guess. Yeah. Well, yes, so absolutely. I think tailoring the approaches and maybe doing serology testing if there are people who would rather know that they are immune rather than get another vaccine. I think that's a smaller scale type of intervention though than a population level one.